All right, so welcome back to part 2 of our articulations lecture. In this part, we're going to look at specific types of movement, so a specific movement at specific joints, right? So all of these movements that we'll look at all occur in pairs, right? So there's going to be one movement in one direction, and there will be another one in the opposite direction, and they're complementary, but they're opposite, okay? So the first one is the first set of movements is flexion and extension, and these are occurring in a sagittal plane, right? So you define flexion and extension by what happens to the angle between bones whenever the movement occurs, right? So in flexion, you decrease the angle. In extension, you increase the angle, all right? So in flexion, think of your elbow. If you have your arm out perfectly straight, and you flex at your elbow, right? So if you have your hand right out in front of you and you bring your hand towards your face, you're flexing your elbow, you've decreased the angle at your elbow. So if your arm is straight, you're at 180 degrees. If you flex straight up, you're at 90 degrees. If you come in even more, you're at 45, and so on and so forth, okay? So this brings the bones closer together. So it brings the humerus closer to the radius and the ulna, all right? Now, if you know one, you kind of by default know the other because it's exactly the same except that it's different in every way, right? So we're flexing, decreasing the angle. When we extend, during the extension, we are increasing the angle between bones, right? So we have our arm at 90 degrees, and then we extend the arm out, we extend the elbow out, and now we're at 180 degrees. So we went from 90 to 180, so by definition, we performed extension, okay? You can do the same thing for the leg and the knee and the hip and the shoulder, but sometimes it's just easy to use the elbow because it's generally pretty easy to understand. Now you can go beyond some of these and you can have what's called hyperextension, right? So if we go to the next slide here, we can have hyperextension. So if extension by definition was increasing the angle of a bone or of the angle of a joint between two bones, hyperextension is just increasing it beyond anatomical position, so beyond the normal 180 degrees, right? So if you look at this guy's leg right here, that leg is obviously in a it's in the wrong position, right? In other words, so if this leg was normal, so here this leg, this knee here is in slight flexion, okay, very slight flexion, so the angle is slightly decreasing. If you were to extend this leg out straight, it would be in extension, but this one has gone beyond the normal 180 degrees, past that, so some type of blow, some type of trauma, maybe hit this guy's leg and forced it backwards, and so this is an example of hyperextension, okay? You can also have more normal, so this is obviously not a normal position. You can have some normal hyperextension, like hyperextending the neck, right? So if you lean your head backwards and look up at your ceiling right now as you're watching this, you are hyperextending your neck, all right? Okay, so the next set of movements is going to be in relation to the midline of the body. So if you remember from our first couple of chapters, in our first few lectures, we talked about anatomical terminology and we talked about directional terms. And one term we used a lot was the term, or the terms medial and lateral, all right? So these two movements are in reference to the body's midline, okay? So medial meant closer to the midline, lateral was further away. When you're talking about a movement closer to or away from midline, you use the terms abduction and adduction, all right? So the term abduction, this first one, abduction, this is moving away from the midline, right? So look at the root of this word, abduct. So if you are abducting someone, hopefully you don't abduct someone, but if somebody abducted you, then they would take you away, right? So in this instance, you're moving away from the midline, right? So here's the midline, you move away from it out here. Likewise, the second one, add a deduction, adduction, you add it back. So you're adding it back to the midline. So we're going from out here and we're coming back in. We're swinging back in toward the midline. All right, very easy. You can have the same thing occur on other parts of the body. So this is for limbs, but you can also have this occur for your digits as well. So if you think of your hand, if you spread your hand, or I'm sorry, if you spread your fingers all the way out, your fingers are in abduction. Okay, in this case, midline for your fingers, midline is your third digit, right? So your middle finger. If you spread your fingers out, you're in abduction, abduction. If you bring your fingers back in, you're in adduction, adduction, okay? All right, so this third one, this is combining the first two sets of movements, right? So in other words, we're taking flexion and extension, and we're taking abduction and adduction, and we're combining all of them into a new movement called circumduction, Okay, so circumduction is when you move the extremity, either the leg or a finger or the arm, in a kind of cone-like circular motion. Okay, now this is not the same thing as rotation that we'll talk about the next slide, but it's circumduction. So you're moving it in a large circle. So imagine if you had a pin in your hand and you had it stretched out onto a whiteboard. In order to make a circle without bending your arm, you would have to move your whole arm in a circle. That would be the movement of circumduction. All right. Now rotation is moving along a longitudinal axis or an axis that is parallel to the uh, extremity or to the digit in question, right? So imagine if you stuck a metal rod up your leg or you stuck it up your arm, you would only be able to, and into your torso, something like this, or into your shoulder, you would only be able to move that limb, the arm or leg, around that rod, right? So you're not moving the whole arm, you're just pivoting and twisting the extremity or not the finger, the extremity around that axis, right? So our ball and socket joints are very good at this. So things like your hip, things like your shoulder as well. You can do this for the head and neck, right? So you can look to the left, you can look to the right, you're just rotating, and you have some degree of rotation in your back as well, so with your intervertebral discs, okay? So these four here, so flexion, extension, abduction, adduction, circumduction, and rotation, these are relatively common and relatively straightforward, okay? Now, these next few that we'll look at are what we're just referring to as special movements, right? They're a little bit different and they occur with more specialized joints in the body, right? So the first one is known as supination and pronation, okay? So supination and pronation occurs with the forearm, and it's occurring at the proximal radial ulnar joint, right? It's also somewhat between the radius and the humerus as well, okay? But largely radius and ulna, proximally. So if you stuck your hands out in front of you, palms up, as if you're asking for something, you want somebody to put something on your hands would be in supination, right? So if you stick your hands out and you ask for supination, you're in supination, right? So here you see palms up. If you had your arms straight out and then you rotate them over, so you take your palms from facing up toward the sky and you rotate them over, you're now in pronation, okay? This is not a movement at the wrist, okay? This is not a wrist movement. This is a proximal radial ulnar and somewhat humeroradial movement, okay? But largely between the radius and the ulna. So if you recall when we talked about the appendicular skeleton, you have the head of the radius proximally, and then on the ulna you have a small little notch, a little depression called the radial notch. Well, as you have muscles that contract and pull this radius over, you have the head of the radius pivoting and sliding in this radial notch, and it allows the radius to come across the ulna perpendicularly, right? So in pronation, right there, you see the bones are parallel. In pronation, you see that they are perpendicular. So in supination, they're parallel. In pronation, they are perpendicular, okay? So this is at the proximal region around the elbow, okay? It's not at the true elbow joint, but it's near the elbow. Second, you have what's called dorsiflexion and plantar flexion, right? These are movements that are occurring at the ankle, largely between the talus and the tibia, so at our talocrural joint, okay? So if you think of where the dorsal part of the foot is and the plantar part of the foot is, then these movements make sense. So the dorsal part of the foot is the back of the foot. So if you look at this example, this back up here. So when you pull the foot upwards, so you pull it superior toward the back part, the top of the foot, that is dorsiflexion. So this movement that this foot is about to perform right there, that is dorsiflexion. Plantar flexion is toward the plantar surface. So when this foot presses down, like it does right here, so it's about to push down right there, that is plantar flexion, all right? Now, you also have what's called inversion and eversion. Inversion and eversion have to do with the movement between, somewhat between the talus and the tibia, but largely between the tarsals themselves, so at the intertarsal joints. This has to do when we move the foot inward, so toward the midline, or away from the midline. So if we bring our large toe, so if we think of this leg here, this would be the left leg, this is the midline over here. If you bring this foot and these toes inward and kind of raise this medial edge of the foot superiorly, this is inversion. When you move it more laterally out here, the pinky side of the foot goes up, goes more superior. This is called eversion. Okay. For both dorsiflexion and inversion eversion, when you perform these movements, you can feel on your leg, if you just put your hand down on your calf region, whenever you perform these, you feel lots and lots of muscles contracting. All right. So you have various muscle compartments that we'll talk about in a few lectures whenever we do our muscles and we do muscles in lab. And these compartments the muscles in these compartments perform very specific functions, right? So some of them are called dorsiflexors because they result in dorsiflexion. Some are called plantar flexors. Some are called inverters of the foot. Some are called everters of the foot. Okay, same thing when we look at the hand. There is a muscle called the supinator, and there's a muscle called the pronator. All right, the pronator teres and pronator quadratus. They perform these specialized movements. Okay. All right. Now we also have movements of the fingers and movements of the mandible. All right. So one is called opposition. Right. So if you think of opposing something, you are putting things together. Right. You're mashing them together. All right. So when you take your thumb and you bring it over to your your second digit, your third, your fourth, or your fifth, you are opposing your thumb towards something. Right. And so this is a very unique and special movement. You have a specific muscle in the meaty pad of muscle that you find at the base of your thumb and as well as the base of your pinky called an opponens. Okay, so the opponens muscle, you have one at the base of your thumb called the opponens pollicis brevis, and you have one at the base of your pinky, your fifth digit called the opponens digiti minimi. And these are opposing muscles. They bring the thumb and they bring the pinky in closer to each other, so we're able to form an opposition. We're able to grab things, right? So anytime you grab a pen, you grab a pencil, you grab your phone, you are in the act of opposition. You are bringing your thumb against something and then another finger against that object as well, okay? All right, and then we have movements of the mandible, okay? So you have elevation and depression and protraction and retraction. Elevation and depression are relatively straightforward. You're moving the jaw up superiorly, so as if you're closing your mouth, you're closing your mandible. And then depression, you are opening your mouth. You're opening your mandible, you are depressing it down, right? And then protraction and retraction have to do with the anterior posterior movement of the mandible. So if you protract your mandible, you push it out, right? So as if you're giving yourself an underbite. Retraction, you are retracting. You are bringing it back in underneath your upper jaw, underneath your maxilla, right? Now, you have another set of movements, or another type of movement called an excursion. And I don't highlight it here, but an excursion is when you move the mandible from left to right, right? So you can very easily shift your jaw side to side. We have muscles deep to our mandible called pterygoid muscles that attach to our skull, and then they attach to our mandible, and they pull the mandible from side to side. And all of these movements, elevation, depression, protraction, retraction, and excursions, all help with the process of mastication, right? Mastication being the process of chewing. Okay. All right. So here's a video that you have access to in your PowerPoint. You can copy this into YouTube and you can watch it, but we're not going to go over it. All right. So we're going to stop here and we'll pick up with the next part by talking about our first type of structural classification of joints, which is fibrous joints.